Today, I have the pleasure of having Shelly Brantley for our tobacco interview for today. And Shelly, would you like to introduce yourself?
Sure. My name is Shelly Brantley, and I'm project director for RISE. RISE is a program of the California Health Collaborative. So RISE is a statewide rural coordinating center, and our discussion today is about health equity, and RISE stands for Rural Initiatives Strengthening Equity. So our project is very much in focus with and supporting rural projects as they go toward making changes in their local community as it relates to tobacco projects.
Great. Thank you so much, Shelly, for taking your time out of your day to participate in our interview.
It's great to be here.
All right, so let's just get on to the interview. And one of the first questions that I have for you today is, what are some of the current top tobacco related disparities that we are currently trying to address?
Rural communities have been adversely impacted by tobacco use. And when you think about some of the images about tobacco use, I'm quite a bit older than you are, but if you, and some of your listeners, if you think back about the Marlboro Man or Winston Racing, the tobacco industry has used images and things that we value in rural communities as critical parts of their marketing plan. They understand that rural folks are independent thinkers. We value our natural environment. So they use imagery that relates to that. So I'm giving that as sort of the background of our tobacco use history is having been impacted by the tobacco industry for so many years. It's not like all of a sudden they said, oh, let's target rural communities. We haven't done that yet. They've been targeting rural communities for many, many years and doing so purposefully, right? Understanding that we're an important market. We're not, the most populous market, but they understand that obviously the tobacco companies want every single person using their product. So they use whatever marketing they think will impact that particular segment. And so that's why we see disproportional tobacco use in rural communities. You asked what are some of the disparities, and unfortunately, we see from adults to young adults to high school students, rural use of tobacco products is significantly higher than the California general population. If you look at the general population, it's less than I think we're looking at 11% maybe of the population now, whereas if you're looking at a rural population, you're probably looking more at 25% of the population of rural adults in California. That's a significant disparity in rural populations. And so just that one thing, adults smoking more, what impact does that have on our local rural communities? I think your other discussions around health equity, you may have had folks talk about impacts on the healthcare system and behavioral health systems. This is all impacted. Smokeless tobacco use, vaping use, those are all disproportionately high. So adults are smoking at a significant higher rate. Rural residents start smoking at an earlier age. That's a disparity. Again, the images that we see in tobacco marketing appeal to rural folks, Something folks might not understand is that rural stores are more than twice as likely as other stores to sell products like chewing tobacco as compared to their non-rural communities. So the retail environment is vitally important to the tobacco industry and their marketing. But when you talk about rural communities, the retail environment, there's not a lot of stores, right? So there's a limited number of stores that you can go to do your shopping. So if that store is inundated with tobacco products and tobacco imagery and marketing, you're going to be exposed to that. Kids are going to be exposed to that. So it's kind of this insidious, it's just always in our face, when in rural areas, because that's where tobacco has put their money. The tobacco industry is marketing in those areas.
Yeah, I remember reading from the CDC Health Equity and Tobacco Control Best Practices Guide you shared with me. And there was a little excerpt specifically about the rural communities and how the tobacco industry and tobacco use is really integrated in rural culture and communities, in that they're less likely to quit smoking. And as well as the tobacco industry there is also a means of living wages for different people in the rural communities as well. And I think it just would be really hard to create more smoking cessation in rural communities as they are targeted by tobacco industries. And so my next question would be is, how will tobacco use be reduced in rural areas?
You can look at reducing tobacco use. Obviously, to reduce tobacco use, you want to help folks quit smoking. That'll drop your tobacco use rates, tremendously. The flip side of that is preventing youth from smoking. So let's start with the adults or young adults who are addicted to tobacco products. Most of them want to quit. What we find in rural areas is a difficulty in accessing tobacco cessation services. So number one, are there local services in your local small town to help you quit tobacco use? There are fantastic resources that the state of California has developed. California Smokers Helpline, which is now called Kick It California, has been around for 25 to 30 years, and they do a fantastic job of helping smokers quit. But that's one modality of quitting. You actually have to call the Smokers Helpline and get a call back, and there's steps in the process, and some people that's not a process that works for them individually to help facilitate them quitting. So ideally, there's a variety of models of quitting available to a smoker, so they can find what works for them, right? Everyone knows that typically you don't quit smoking on your first attempt. It's many, 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 many attempts to quit smoking, and probably you will learn different steps that work. So in a rural community, we want to have as many opportunities for folks to quit as possible, using as many different means as possible. Sometimes meeting in a group is a great way to quit. Sometimes meeting individually with a counselor is going to help someone quit. Sometimes that phone intervention is the best way. The disparity in rural areas is that not all of those modalities are available. You might not have a group cessation class. You might not have a counseling center. So all that might be available to you is is a telephone counseling kind of service, which is a great service, but then that requires a lot of individual motivation to make the call, to follow up with calls, to answer the calls when they call back. And there's also assumptions about having internet access and things like that. I mean, when we talk about rural, there are difficulties in accessing some online or telephone services. So those are all things we have to think about when we're saying, how can we help people quit smoking? We need to make it as easy as possible. And having a variety of services is always the best option. That's not always what's available to smokers in rural areas. So having as much as possible given our limited resources.
Right. I believe with all the other interviews I've done with different topics for this health equity campaign, that access to care is one of, if not one of the more important factors we need to focus on, especially for rural communities. Also touching on the fact that rural communities don't have certain resources and that we do need to go with a tailored approach rather than a one solution for all. It's also the fact that rural communities a lot are low income, correct, and have lower education levels. And I believe many of them are on Medicaid. Even then, I saw in the CDC, referring back to the CDC best practices guide, that those who have Medicaid are less likely to quit smoking successfully compared to those with private insurances. And so I think that's just another disparity that we need to also address and focus on as well, improving Medicaid provided tobacco cessation programs.
And improving the services that they reimburse for, making sure that there's a variety of services. It's always better to have pharmacological support while you're quitting smoking, along with the counseling aspect. So if you're able to access the Kick It California website or telephone counseling, then they can help with pharmacological aids, quit smoking aids, patches, gum, nicotine aids, those types of things. But again, your point about disparities is critical. That takes a lot of personal motivation to access all the steps, right? And in a low income, perhaps a low educational area with very few resources, it's difficult to put a plan together that's going to work, for an individual. So I think you're right in that, maybe beefing up what Medicaid reimburses and what services they cover is a great way to go for our rural populations.
Yeah, I would definitely agree, Shelly. Thank you so much for answering that question.
Sure.
I believe you did touch on how many smokers start usually in their youth, or the younger adults start, especially in rural communities, they're smoking. And so with most smokers starting in their youth, how are health promotion efforts and anti-tobacco programs being implemented to target this population?
There's been a lot of work done in California over 30 years in educating the public about the harms of tobacco use, particularly the harms of smoking. And I say that in particular because that has been the primary focus of California's tobacco control efforts, is to educate about the harms of smoking and the harms of secondhand smoke exposure. I say that to say that, there are also new emerging products that you wouldn't define them as smoking necessarily. So I'm talking about vaping products, which is kind of new within the last 5 years or so. But also smokeless tobacco use That's a you know, a tobacco product that's used primarily in rural areas. And so when you say smoking cessation, or you say preventing kids from starting smoking, or smoking, everything is framed around smoking. And so smokeless tobacco users, you know, sometimes they don't identify as that tobacco user because they don't hear their product mentioned, right? They're a smokeless user, they chew, they're a chewer, they're not a smoker. So they might not think the resources are available for them. You know, are there quit chewing resources available? So, you know, part of what I want to do, and part of my role with RISE, is to sort of normalize and kind of call out, you know, chewing tobacco and smokeless tobacco use. And, you know, as I mentioned when we first started talking, the amount of advertising that the tobacco companies just really pour into marketing smokeless tobacco and making it seem like a normal part of a rural lifestyle. If, you know, growing up in a rural area, it's not unusual for, and I want to make the distinction, there are female smokeless tobacco users, absolutely, there are female chewers. Primarily, it's a male product, the males that use the product. So the culture around smokeless tobacco use is, in a rural area, typically the can of chew is shared amongst older brothers or cousins or uncles. And even, you know, I've heard fathers, well, they're out fishing, they're out hunting, they're out, you know, working on their ranch. It's part of the culture. They don't see it as, oh my God, like the person that would never consider giving their cousin a pack of cigarettes, but they don't think twice about giving them a can of chew, right? What is that disparity? What is that disconnect in that thinking? So I think there's a lot of opportunity for us working in rural tobacco control when we're talking about health promotion and health equity and disparities, to also think about, it's not just smoking and smoking cessation. You know, we need to kind of consider the totality of the tobacco products. And, you know, so smokeless is part of that family of tobacco addiction. Vaping products, e-cigarettes, e-juices, liquid nicotine, nicotine salts, nicotine pouches, nicotine dissolvables. If there's a way to put the addictive nature of nicotine in a product, the tobacco industry has developed that product. It's on the market. We need to be aware of all of them and try and combat them the best way we can. Tobacco companies are always steps ahead of us because they have essentially unlimited resources, and we in working in public health typically don't have unlimited resources. But your question of, so how do we combat some of those, just the vast marketing arm machines really of the tobacco companies, is to really win the hearts and minds of local communities and local policymakers. You know, what changes a community is when you can make that behavior no longer the norm. So if you grow up and you don't see people smoking or see people chewing or vaping, then you won't in your mind think that's a normal thing for adults to do, or that's normal in my community or normal in my family. if we can break that normalization, then we can change the community. And to do that, you need to have laws in place that regulate the product and where and when the product can be used and where it can be sold and what the components of that product could be. And so I'm referring to like flavored tobacco products. You know, there's so many flavored tobacco products just inundating our local communities. And, you know, we can regulate that. You know, a local community can make local regulations based on what they value in their local community. So any community can say, well, they could ultimately say, this product has no value in our community. We don't want any tobacco products in our community. No one has done that. Beverly Hills has banned the sale of tobacco products in Beverly Hills, with the exception of, I believe, cigars in hotel lobbies. So a community can say, this is our value, so we can regulate what's sold and what's allowed to be in our community. And that will change the health of our community, and that will change the generational norm that we see in rural communities of a general acceptance of tobacco use.
Thank you, Shelly. I feel like you hit a lot of great points, and the fact that you did mention that tobacco use isn't just smoking. And I think I've come into a realization that a lot of the messages, at least for me in my area, that a lot of anti-tobacco messages that I was exposed to was mainly focused on just smoking and vaping rather than chewing tobacco and non-smoking use of tobacco use. And I think that'd be great to implement more messages about the different varieties of tobacco products that are valued in, how you were saying, from rural areas, and to really break that generational norm of using tobacco products.
And I think that's, you know, I don't know where you grew up, but I think you're exactly right in that you might not know what smokeless tobacco products are out there. Why would you, if you're not if you didn't grow up in a rural area, you might not be exposed to smokeless tobacco at all.
Exactly.
But if you ask a rural young adult, someone around your age, then they absolutely would know what you're talking about and what the products are and what the flavors are and what are the differences between long cut and regular cut and wintergreen and menthol. And you know, there are nuances with smokeless tobacco products, and you know, it's just natural for a kid growing up in a rural area.
Right, and that just goes to show the importance of tailored messaging and program implementation, because obviously my area didn't, you know, have to require more messages about smokeless products rather than smoking, because probably here in Sacramento that smoking rates are higher than those products compared to rural areas.
Absolutely. So you're right. That's why we have to be strategic. We have limited resources, so we have to be very strategic in our planning. How do we, for us to impact the most folks who, number one, need to quit, or impact, you know, try and keep kids away from tobacco product, we have to be very strategic with our thinking and with our dollars, and how best can we do that with limited budgets. And again, that's, you know, something I don't, every rural, you know, project has to think that way, because we're all faced with the same dilemmas.
And so with wrapping up the interview, my last question is, how do you see upcoming changes of tobacco use and reduction in the future with the goal of health equity in mind?
California is right now in a really interesting place. You know, we have had a tax on tobacco products now for over 30 years that have funded really innovative anti-tobacco projects, tobacco education, tobacco prevention, tobacco cessation for 30 years. But there is still a smoking and nicotine addicted population in California. I might not get the numbers right, but I think that given our population numbers, the percentage of smokers in California is equal to the population of Oregon. So when you think about, well, only 10%, 7, 8, 9, 10% of Californians smoke, you think, well, we're doing pretty good, right? That's kind of a small number, but given the entire population of California, that's a large number. There are a large number of folks who still are addicted to tobacco products, youth who are experimenting and becoming addicted onto nicotine. So we have to think strategically beyond the methods that we did 30 years ago. I alluded to the retail environment being such an important part in a rural community. That's where tobacco companies sell their product, obviously. That's where they market their product, where they position their product to make it flashy and enticing to youth. I think having strategic policies that regulate tobacco products in the retail environment is really going to be critical moving forward in rural communities. I think I'll be bold and say, what's good for Beverly Hills is good for rural. If Beverly Hills can say there is no redeeming value of tobacco products, we don't want it sold in our community, why can't we say that in a rural community? We can. So it's just going to take some leadership. It's going to take some people that are willing to stand up and say, this is a change we want to make. California is looking down the road and saying, we want to eliminate the sale and the use of tobacco products. Let's look down 10, 15, 20 years down the road. Why not make California a tobacco-free state? We can do that and turn it around and say, so what benefit would that have on the state of California? We haven't talked at all about what the financial impact tobacco use has on our rural communities. You've talked to healthcare providers and behavioral health folks. There's not enough medical services affordable enough to deal with the health issues of tobacco users, right, in rural communities. If we could eliminate the product, then we could eliminate that disparity of not having enough healthcare available, right? Mm-hmm. So that's long-term, that's aspirational, that's looking, like I said, 10, 15, 20 years down the road. It's bold thinking, but California is a bold state. And I would say rural communities can and will be part of that bold initiative and can lead, because going back to the core value of rural communities, I mean, it's about family, right? It's about connection, caring about your neighbor, about your community. And what better way to show that than by saying, this is a product that has no value in our community and in fact is very, very detrimental to our community. Let's get rid of it.
Thank you, Shelly. I really like that positive outlook and hope for the future in ending tobacco use without California. I know you said it's a bold move, but it really would, and I would believe, improve future health outcomes, and how you said that it would strengthen communities, because then there'll be less people suffering from these different effects of tobacco use. And I think that would be a great goal to look forward to in a long-term situation.
Let's do it.
Thank you so much, Shelly. That will conclude our health equity interview campaign for today. Thank you so much for your time and your knowledge and expertise.
Thank you, Lisa. It's been my pleasure. Thank you.
Thank you.